So today in this video we are going to discuss about the Gastrinoma triangle. This Gastrinoma triangle, it is also known as the Passaro'S triangle. So before starting, I want you to look at the image that I have drawn here. So as you can see, we have the left hepatic duct and the right hepatic duct. They both joins to form the common hepatic duct. Now the duct which arises from the gallbladder, it is also known as the cystic duct. This cystic duct get combines with the common hepatic duct and it forms the common bile duct. Now this common bile duct, it goes and opens in the second part of the duodenum. So this is the basic orientation that we need. Now coming to the boundaries of this triangle, of this Gastrinoma triangle. So as you can see, the first boundary, that is the junction of the cystic duct with the common bile duct. Now the second boundary, it is formed between the junction between the second and the third part of the duodenum, as you can see. And the third one is the junction between the head and neck of the pancreas. So these three junctions, when they meet, it forms the Gastrinoma triangle. Now coming to the contents of this triangle. So as you can see here, there are several contents like the first part of the duodenum. You can see some part of the second part of duodenum. We can also see the head of the pancreas inside this triangle, and some lymph nodes, they are also present within this triangle. Now one question that arises in our mind is that what is the significance of this Gastrinoma triangle? Why we are discussing it? So the most important significance is that it is the most common site for the gastrinoma, which is a endocrine pancreatic tumor. So ये जो gastrinoma है, ये एक endocrine pancreatic tumor है, and it is seen in MAN1 syndrome. And this gastrinoma, it arises from the G cell of the pancreas, which produce a lot of the gastrin. So because of this increased production of the gastrin, it leads to increase in HCl production, that is hydrochloric acid production. And if there is more acid production, then it increases the risk of the peptic ulcer. So the gastrinoma, which is associated with increased acid production and recurrent peptic ulcer, it is known as the Zollinger-Ellison syndrome. So that's all about the Gastrinoma triangle that we need to know in this video. Thank you.